After almost 1 year since the implementation of ECQ in Luzon, the proposal to place the country in the least restrictive lockdown is starting to pick up steam. How are health workers reacting? Let's hear from Dr. Maricar Limpin. She is the Vice President of the Philippine College of Physicians. Good evening, Dr. Limpin.
Hi, good evening, Robbie, and good evening to all our televiewers.
Hey, Dr.
So,
Lim, are we
yeah,
ready? Are we ready for MGCQ? What is the perspective of public health professionals here?
your frontliners, us frontliners, are always ready to serve the country, no? So, it's not a question of whether we are ready or not. Ang tanong siguro natin dyan, are we all ready to go into MGCQ? Kasi easing up these restrictions means na ang shift of responsibility will be on the individuals na. Talagang purely the heavy responsibility nasa atin ng mga mamamayan, ano? So malaking responsibilidad diyan. So meaning to say, we all of us must make sure that we will be following the health protocols. Face mask, face shield, and the physical distancing. And secondly, pag dumami, we can expect dadami ang tao na lalabas, no? And that means marami ang mga ngailangan ng transportasyon. Ready na ba tayo diyan? As of now, nakikita naman natin na karamihan ng mga jeep, punong-puno, wala nga physical distancing. May mga bus na nakikita tayo na puno rin, no? Wala ring halos physical distancing yon, no? So, I don't think na as far as transportation service is concerned, kailangan siguro siguraduhin muna na magkakaroon ng access ang mga tao sa sasakyan at mapapanatili natin na pag gumamit tayo ng sasakyan, no, tayo naman ay safe na makakarating sa ating kaparoroonan at makakabalik din ang bahay ng safe.
Hey, Doktora, malinaw naman yung mensahe nyo. Yung responsibilidad, yung accountability comes down to the individual. But when that spike in numbers and that rise in numbers goes up, that will be of little consolation that we can turn to each other and say na, oh, sinabi ko naman sa'yo, mag-ingat ka. What's the worst case scenario for all of us, and what do you think should there be a mechanism or a fail-safe in place? And what are the indicators, do you think, that should prompt government, both on the national and local governments, to reconsider MGCQ?
Well, siguro, no, as far as we are concerned, definitely, even with a spike in the number of cases, medyo magdadalawang isip na kami in asking for a timeout. Kasi we know how heavily burdened the Filipinos are pagdating sa ekonomiya. So medyo mahirap nang talaga yan, Robbie. But that is also the reason kung bakit when I told you, no, na the greater responsibility is shifted to us, but at the same time, meron ding responsibility ang mga LGUs and also the national government to provide a safer transportation for each and every Filipinos who will be going out of their house. So, importante na may equal responsibility rin naman, ano? But we have to be sure na lahat ng ito kaya natin gawin. Kasi if not, then I would actually support few of those LGU city mayors natin dito sa Metro Manila na nagsasabi na wag mo nang gawing modified GCQ ating quarantine measures.
But Doktora, in the meantime, nandyan na po yan, and now the mayors have voted. It was a close vote, but at the end of the day, the Metro Manila mayors did endorse this. Do they have enough to mitigate against the situation that we fear, particularly their option still to have targeted lockdowns?
I think pag may nakita sila na medyo tumataas na kaso in certain barangay, in certain community, then immediately they need to put this community in lockdown, no? And then make sure lang na those who will be getting sick, no, meron din silang kapupuntahan, meron silang mga isolation facilities na pwedeng puntahan, at yung mga ospital naman din nila ay handa, no, tatanggapin ang mga tao na pupunta because of COVID-19. As of now, no, right, hindi lahat na ng ospital, even government hospitals, ano, sometimes pag nakita nila na ang tao ay galing, like let us say from Manila, ito ay nakikita na namin na experience na, tapos dumadating like let us say sa ospital dito sa Quezon City, pinababalik yun sa Manila. So, medyo malaking ano yun, no? Malaking problema yon, because that means that itong mga taong ito will have to be traveling and will have to wait for many hours bago sila mabigyan ng attention doon sa kanilang medical condition.
Okay, Dr. Limpin, maraming salamat po. That was Philippine College of Physicians Vice President Dr. Maricar Limpin.